you, Dr. Krishna. Thank you, Shumanto. Incidentally, there are a number of things that have no marble plaques in this hospital, but I can claim of having started them, starting with the respiratory care unit in the ICU. That was a one-man army without any residents, which my colleagues in the department have the privilege of having 3 extra persons. The PAC clinic, which is running successfully for so many years now, had to face a lot of resistance to be started by my senior colleagues. But keeping with the convention in the other hospitals, I had taken the plunge against all opposition, started, and it is successful and essential. Similarly, the pain clinic, the entire concept of a pain clinic was unknown to many of our colleagues. The seniors had to be convinced for forwarding the papers to the railway board for approval. Finally, it has been done. But like every new practice, this will also take a little time for our colleagues to utilize the facilities of a pain clinic, because the concept of quality of life has still not sunk in. And incidentally, all my colleagues who are treating cancer patients will also agree with me that they cannot guarantee life to them, but they can definitely give them a better quality of life. That has become the dictum, not only here, it is Government of India policy now of making pain and palliative care a principal project in all hospitals, government or non-government. They are arranging for training programs run by the central government at specialized centers. So you can understand that relieving pain is also part of not only the pain clinic doctors, but also each and every clinician who is treating his or her patients. I am thankful to Shumanto that with the meager manpower, and Surjo Broth of course, but then Surjo has a different story to tell. Surjo is picking up all these techniques not only for the benefit of the patients, but because he is more interested in enhancing his knowledge. I wish more of our colleagues could have that concept in their mind, because you are not only improving yourself, you are also becoming an asset to whichever institute that you go. I am sure that after today's presentation, our colleagues in all the departments will again think over referring their cases, assessing their cases, and giving the railway patients the privilege of attending a pain and palliative care clinic. I think orthopedic pain you have definitely stressed as back pain, but there is another very big segment which our gynecologists and our surgeons can definitely help in. Even our, I don't know where our ENT surgeon is, I am not able to locate him. Because head and neck oncology is another sector where a severe pain can incapacitate a patient, where a ton of oral analgesics or injectable analgesics cannot relieve the patient, which can be relieved like magic by an interventional pain therapy. So I hope the thing catches on. There are many few things that Dr. Poddar and Dr. Dasgupta have in mind, and I am sure Dr. Patnaik and Dr. Krishna, Dr. Sengupta will help them in finding, if not many, at least 2 beds, if not many, at least 1 or 2 attendants to help them in their interventions. And finally, we are trying very hard to get a 3rd anesthesiologist for this hospital, so that you don't have to run all these things by remote. Most of the ventilation is done by remote. We are compelled to do it, I am sure, but that should also be taken, that you involve the other residents and postgraduates also in pain therapy, because like Dr. Poddar and Dr. Dasgupta had said, that this is not to be restricted to one specialty only. This is a multidisciplinary subject. So there should not be any harm in if a surgical postgraduate picks up the blocking techniques or attends the session where the block is being given, or a person from the ENT department or a person from the gynae PGT attends the block sessions, because they are going to give them an insight and also help them in tackling their patients in the future. I thank everybody, in fact Dr. Poddar, for coming from such a long distance to this garden which is really not beyond reach. Thank you.